Does your sleep get worse when you're worried or stressed about something? I would guess that most people will say yes. Even if you're so tired that you fall asleep, you might wake up in the early hours of the morning with your mind racing. My name is Dr Sophie Bostock and I'm a sleep expert. In this video, I'll talk about how poor sleep and anxiety are linked and some strategies to help address both. So why does stress and worry make us more vulnerable to poor sleep? If our brains sense danger, we feel anxious or threatened, or we're in a situation which is out of our control, we ramp up our fight or flight stress response. This is designed to keep us on high alert and ready to run. The body releases adrenaline, speeds up the heartbeat, increases blood flow to the muscles, and releases glucose into the bloodstream to fuel the body for action. We also release the stress hormone, cortisol. This is why when we feel anxious, we may notice a pounding heartbeat, feel flushed or sweaty or tense. If you experience high levels of stress or worry before bed, it can interfere with the release of melatonin, the hormone that signals the body to get ready for sleep. With less melatonin, it takes us longer to fall asleep and our sleep can become lighter. This means we're more likely to be woken by noise, movement, or changes in temperature. Anxiety can also lead to changes in our daily habits that are unhelpful for sleep, such as having less time and energy for exercise, relying on alcohol to relax, or working late if we're worried about work pressures. These can all interfere with the quality of our sleep. So, anxiety can worsen sleep, but is there any evidence that lack of sleep can also add to anxiety? Brain imaging studies show that lack of sleep makes us more reactive to negative events. The amygdala, the part of the brain which switches on our fight or flight stress response, becomes more sensitive after a restless night. It's as if the brain interprets a lack of sleep as a signal that we could be in danger. We're more likely to feel tense, defensive, and anxious. So, by cruel irony, one of the consequences of poor sleep is that we become more worried about not being able to sleep. Our beliefs about sleep can become unhelpfully distorted. We can start to worry that we'll never sleep well again. Sleep disruption also interferes with our concentration, patience, and ability to empathize, which can make us struggle with both productivity and relationships, leading to further life stress and giving us more things to worry about. Fortunately, because the relationship between sleep and mental health goes both ways, we now know that anything that you do to improve your sleep will have knock-on benefits for your mental health. So what can you do to reduce anxiety and get your sleep back on track? We all experience worry and anxiety to some degree. If your anxiety or sleep problems are severe and they're interfering with how you live your life, speak to your doctor. They might want to rule out medical causes for your symptoms before discussing treatment options. The recommended first-line treatment for both anxiety and insomnia is cognitive behavioral therapy, or CBT, a talking therapy approach that addresses unhelpful thoughts and behaviors that make both conditions persist. CBT teaches you to recognize that thoughts are just thoughts, and we have a choice about which ones we respond to. Unhelpful thoughts are often accompanied by unhelpful emotions. If we challenge the thoughts, we can change our emotional and behavioural responses. CBT is really a toolkit of many different techniques, and the specific ingredients in the CBT for anxiety and insomnia toolkits are slightly different, but I'll introduce a few of them here. CBT for insomnia emphasises some pro-sleep or sleep hygiene behaviours, such as wake up at the same time every day, regardless of how well you slept the night before. Get your body moving every day to help increase your drive for sleep. Only get into bed when you're sleepy and get out of bed when you're not. And limit caffeine. This is because caffeine can actually heighten the stress response and make you feel jittery. Switch caffeine for decaf in the afternoons. CBT for anxiety encourages you to develop a willful tolerance towards the thing that you're anxious about by choosing deliberate exposure. So for example, if you have social anxiety, opting to go to a social event that you might normally avoid. This is about learning to anticipate, recognise, and tolerate the discomfort of anxiety until the brain realises that there is less to fear than it thought. But it's really important that this is done in a planned and supported way to avoid being overwhelmed. Another practice which is often included in the CBT for insomnia and anxiety toolkits is mindfulness. Mindfulness refers to the ability to be fully present in the moment, aware of what you're doing and feeling, but not overly reactive. Being mindful about your emotions is like being able to pull up a deck chair in your mind, sit back and watch thoughts and feelings pass by like clouds without getting caught up in them. This can be a useful approach if you're kept awake by a racing mind. Mindfulness is a quality that we all have, but can be cultivated with practice. Research shows that mindfulness-based training can be effective for reducing insomnia symptoms, as well as helping people to manage stress, anxiety, depression, and chronic pain. So how do you become more mindful? Traditionally, mindfulness meditation involves sitting quietly and focusing your attention on parts of your body or your breath as you allow thoughts and feelings to come and go. Each time you realise that you've become distracted, you gently return your attention back to your body. You can also practice being more mindful when you're walking around or brushing your teeth. Whatever you're doing, you focus your attention on that activity, and as you notice that you become distracted, you gently bring your awareness back. The key to mindfulness is regular practice. Some research suggests that it's harder to be mindful when you're short of sleep. So you might want to start off with just 5 minutes of deliberate practice a day and gradually build that up as you get used to it. There are lots of apps such as Headspace and Calm which teach mindfulness. Alternatively, you could sign up for a group course or one-to-one training. Finally, progressive muscle relaxation is another technique you can use at any time of day or night to help relieve anxiety and get ready for sleep. It involves tensing and then relaxing all the major muscle groups. I'd recommend starting with your toes and working your way up. For example, let's just focus on your shoulders. We can do this together. Shrug your shoulders up towards your ears and squeeze firmly for a count of 5, 4, 3, 2, 1, and then gently release. And enjoy the sensation of tension leaving the body. Each time you breathe out, imagine the tension flowing out from your neck, out from your shoulders, out from your arms, out from your hands, and drifting away. Just let your shoulders relax. We often carry a lot of tension in our muscles without even realizing it. When we relax our muscles, we also relax our minds. Regularly practicing progressive muscle relaxation has been shown to help with stress, anxiety, high blood pressure, back pain, migraines, and poor sleep. So, there you have it. Sleep hygiene, willful tolerance, mindfulness, and progressive muscle relaxation are all CBT strategies which could help to reduce anxiety and improve your sleep. Thanks for listening, and sleep well.